Good morning. My name is Annie Murphy, and I'm here live from the Alzheimer's Association's Rhode Island chapter. I'm the program manager for the chapter, and I'm here today with a special guest, Phil Clark from the Rhode Island Geriatric Education Center. Phil is both a professor and the director of both the program in gerontology and the Rhode Island Geriatric Education Center at the University of Rhode Island. We're actually here together this morning to talk about the Rhode Island chapter's upcoming 11th annual Caregivers Journey Conference and to learn more about RIGEC and what it does in the community to support our professionals, workforce who support the lives impacted by Alzheimer's disease and other related dementias. Dr. Phil?
Thanks, Annie. It's great to be here and to talk a bit about a project that's close to my heart, which is the Rhode Island Geriatric Education Center. But I really want to couch that and put that in the context of partnerships with organizations like the Alzheimer's Association. We're really delighted to be able to partner with groups such as the Alzheimer's Association and others across the state because this is really an important area for us to work in. We are a geriatric education center funded by the Health Resources and Services Administration, called HRSA, of the Department of Health and Human Services. And we're one of the major programs funded in geriatric education by the federal government. We know that there's going to be, and there already is, a huge gap between what trained health professionals are available in geriatrics and what we need to provide adequate care. So our mission is really to work to educate current healthcare providers and people in the so-called social care or human services area. Also people in the pipeline, students and medical residents and other trainees who are going to be future providers. Our particular focus is on primary care in terms of reaching out to primary care clinical practices to get them up to speed on geriatrics. And then the other thing I mentioned is we are delighted to collaborate with both clinical partners and community-based organizations such as the Alzheimer's Association in co-sponsoring programs such as this one.
You know, and we thank you so much for being a continued sponsor for the conference this year. Actually, Rhode Island, the Geriatric Education Center, you are actually one of our top sponsors. And again, we just can't thank you enough for being, a continual support to our chapter and to all the work that we do. I was thinking about, what you were talking about, what your mission is. And I know one of the programs that's going on right now through RIGEC is an ECHO program that's specifically focusing on, cognitive impairment initiative. And I was wondering if you could, tell us a little more about that. And, I'm very curious I believe it's actually already started, but I'm wondering if our professional workforce can still join the ECHO. And if we want to, sign up, if a person wants to sign up, how do they find out about that information?
Good questions. Let me jump right into those, Annie. The Project ECHO is a program that is really taking off, especially in the time of the pandemic. It's using a Zoom platform to deliver professional education to healthcare providers in the community. And it's an incredibly novel way of using the sort of virtual educational options to educate providers. ECHO is an acronym that captures the idea of a program that is being delivered to people in the community from a hub site or hub team where the program originates to spoke sites out in the community who are in clinical practice locations. We have had actually a series of sessions on different aspects of geriatric care called the 4M framework, which stands for what matters to older people, also medications, mobility, and then most appropriately for this series, mentation or mind. And we've been really excited about developing a content area for this spring series on cognitive impairment, and particularly focusing on novel ways of addressing and understanding cognitive impairment, relating to different professions such as physical therapy and music therapy, and really kind of expanding people's thinking about how we can deal with issues relating to dementia. And it's never too late. We have started, people can go to our Rhode Island Geriatric Education website. If you just Google RIGEC, it'll take you to the university's website. And you can see under Project Echo, we actually have a number of Project Echoes going on. Mm-hmm. But you'll be able to tell the one that we're doing right now here in Rhode Island. And you can still sign up. The idea behind Echo is that people commit to a certain number of sessions. So you would really want to try to focus on attending more than one session in the series. The Echo model is an attempt to develop a community of practice for people who really get to know each other and participate in more than one thing. It's not a webinar. It consists of a 15 to 20 minute didactic, small, short lecture on the topic, followed by a case study. And the case study is presented by one of the so-called spoke sites, which are those clinical practice sites I mentioned. But it's an incredibly rich discussion around the topic and the case study. So we would certainly ask people to check that out if you're interested. Also, we will be doing more. This is an ongoing program, and this will not be the last series that we will be doing. We are going to be working on another one starting in the fall.
That's wonderful, and it really ties in very nicely because you had mentioned the 4M model, and at our Caregiver Journey Conference this year, we were actually going to be having one of our presenters speaking about the 4M model, and that is actually going to be held during the second day of our conference, May 4th, virtually. And the presenter is Giulio DeFilo-Dravi, who's actually from Kent Hospital. And he will be specifically, his topic will be using the 4 M's to organize older adults. And the reason we chose this particular topic this year is we want not just our direct care professionals who are attending the conference, but we want our families and those living with the diagnosis to understand how there can be an improvement in the quality of care that they are receiving in the primary care practice and throughout the healthcare system using this particular model. And if I'm correct, I believe Kent Hospital has been certified as a 4M, as a 4M certification. So again, we're trying to educate our larger community so that they're informed.
Well, I think you raised an important point, Annie, that it's not just educating healthcare or providers in general. It's really educating patients and their families about what to expect in care, and particularly what kind of information they need to consider sharing with their provider. It's a team effort, and it's not just the healthcare team, but it's really the patient family and the healthcare provider team working together. Because these issues really require people's involvement from both perspectives. So, and I think that's particularly true with regard to dementia and other similar cognitive issues, because they are complicated and they require the active participation of everyone. So the more patients and families understand, I think the better the outcome, like you indicated.
Absolutely. And, with the association and our partnership with you, we've been partnering together, I think, for over at least 15 years now in providing, you've supported the work that we do in providing educational series for our families, and then also, supporting the professional training that we provide through the Alzheimer's Association. So, I thank you. On behalf of our chapter and the Alzheimer's Association nationwide for, your continued support to our cause. and again, for sponsoring, the conference this year. I just want to just remind people a little bit about that there still is time if you're interested in attending the conference. Again, the conference is going to take place over 2 days. The first day, Tuesday, May 3rd, the conference will take place at the Crown Plaza in Warwick, Rhode Island. And registration and check-in starts at 9 a.m. On the second day, the conference will be held virtually through a virtual platform. And if people are interested in registering, they can go to our website at alz.org/RI or call our helpline at 1-800-272-3900. If you go to our website, you'll see the full listing of all the time frame of the presentations and who will be presenting. And we truly look forward to, having not just our families and caregivers and those living with the diagnosis to attend the conference, but we are offering CEUs for social work, nursing, and this year for our community health workers here in the state of Rhode Island. So it's going to be a robust 2 days of learning, and we just encourage people to attend. There will be opportunities for social distancing, just still are concerned with, keeping people healthy and safe. We are asking individuals to wear masks. They're not mandatory, but they will be available on site at the day of the conference. We will have hand sanitizers and be, doing some social distancing to support those to remain safe while we're all together. So, Phil, thank you so much for being with us this morning. And again, thank you for all the incredible work that the Rhode Island Geriatric Education Center has done and will continue to do to, advance our mission to improve the quality of care and, health for our families living with the diagnosis. So again, thank you so much. And with that, I wish you goodbye, and I hope everyone has a wonderful day. So thank you.
Thank you for including us, Annie. Take care.